Good evening. Today is March 3rd, 2022. The time is 6 o'clock p.m. I will now call this special meeting of ISD 191 Board of Education to order. Welcome to those in our audience and those watching from home. Director Alt, will you please lead us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Do I have a motion to approve tonight's agenda?
So moved.
Moved by Director Werb,
Second.
second by Director Miller. Is there any discussion? Seeing none. All those in favor say aye.
Aye.
Opposed? Motion passes unanimously. First on our agenda, we will get an update about District 191's efforts to implement COVID-related educational and public health guidance issued by the MDE and MDH respectively. We have Dr. Teresa Battle, Superintendent, and Bernie Bean, Lead Licensed School Nurse.
Thank you, Chair Chester and members of the board. At your last regular board meeting on February 24th, Bernie Bean and I shared some recommendations to transition our health and safety procedures. At that time, we also shared that we are awaiting recommendations with new guidance from Centers for Disease Control. Well, the day after that board meeting, was it the 24th? Right, the 24th, the 25th, CDC did come out with new guidance. And so tonight, Bernie Bean and I are going to reiterate our recommendation, and then later in the agenda, you will be discussing and acting on 3 resolutions based on those recommendations. So I'll turn it over to Bernie Bean for the first few slides.
Thank you, Dr. Battle. Good evening, Chair Chester and Board of Directors. Typically, at the beginning of my presentation, I would go over data. And the good news is that data is still going downwards, what we like to see. For District 191, last week we were informed of 9 positive cases for students and staff in our district. This week that total is at 7. So our numbers are extremely low right now. The trajectory for the county numbers continue to indicate a decline will happen. Next week, Scott County is indicating they will have only 13 positive cases in their county. The current and the predicted data supports our switch to an endemic focus for disease prevention. However, health and safety continues to be the core and the foundational piece to a disease prevention model. Like Dr. Battle said, last Friday, CDC released a new metric for measuring the impact of COVID-19 illness on the community. The prior metric, which was the level of transmission, was started September 2020. That seems like a really long time ago with COVID. The shift to this new metric was partially due to the waning validity of the level of transmission metric, along with the current science, and the tools that we have on hand now, such as vaccines and testing. This new metric continues to look at the 7-day case rate per 100,000, along with hospitalizations and the hospital bed availability. The community impact is categorized as either low, medium, or high. The new guidance also provides some prevention interventions. In the low category, the recommendations would include staying up to date on vaccinations and testing when symptoms are present.
Bernie, I'm going to ask that we show the new chart that's based on the low, medium, high transmission. At the last board meeting, board members did ask for the chart, the new chart. So thank you, Bernie, if you wanted to walk them through. Bring up a little bit more, scroll down to the bottom, you'll see the new chart.
If you were to look for your county specifically, this is the spot where you would enter your county and be able to pull up the measurement for your county. And as you can see, they've continued to keep the metrics of the cases per 100,000, and they've categorized it as less than 200 or more than 200. And then the next category, the indicators, are the hospital admissions and the percentage of beds that are available. And when it's less than 10%, that would get you in the low category of impact to your community. Okay? If you scroll down further on that, there's actually another, a whole slide presentation that CDC put together that talks about the science and the research that they did to come up with this new metric and why they feel that that's a better indicator of in projection of what's going to happen down the road if something were to happen. Okay, so Scott and Dakota County are listed in low category, which means cases are under the 200 and the admissions and the hospital beds for COVID patients is less than 10%. When community levels are low or medium, the universal indoor mask wearing is no longer recommended. However, regardless of the community level, I remember when we first started with COVID, we all had our own personal journey on wearing a mask, wearing a face shield. And we all had different paths that we took to get to that piece of proficiency with wearing a mask. Well, it's going to be the same going without a mask. We're all going to get to that point. We all will have unique paths and comfort, and that's okay, and that's respected. We all will get to the same spot, but we all need our time to get to that spot and be comfortable with that. Okay. The CDC does recommend or advises that you can wear a mask at any time if you choose that. The times in general that they do recommend that you wear a mask would be as if you have symptoms, a positive test, or you've had a known exposure. They would recommend that you wear it at that time. Not required, but recommend it. Okay. So we also had another change with transportation. On effective February 25th, the CDC removed the requirement for wearing a mask on buses or vans operated by public or private school systems. This includes early care, education, and early childhood programs.
So I'll add to that, before you tonight is a resolution regarding face coverings. That recommendation, as you'll see, is going to keep the requirement for our preschool students. And so there is a consideration before you, the impact of them riding on school buses. So.
Okay. One thing we've learned with COVID is how to be really good with our mitigation and our prevention strategies. And this district has been gold star in how we have done those. A couple that I want to point out is staying home when you're sick. To promote a healthy environment, that means that we all stay home when we're sick. That takes that continued partnership. And I would just encourage families, if you're unsure, or even staff, if you're unsure if you're well enough to be in school, reach out to your health office. That's what we're there for, to help you, guide you through that process. It's confusing, and our goal is that we keep our community safe. And that's one way we can do it, by that partnership. The other one is case tracking and surveillance. A licensed school nurse is certified in public health nursing. That means disease surveillance and management is our expertise. And that's core to who we are as licensed school nurses. And so we've done that before COVID. We will do it after COVID. We've done it during COVID. That's just a part of what we do in our health office to make sure that our environment is safe. And the last one is the testing opportunities. Last week we did get another large shipment of home testing kits, and we have creatively found ways to put those into different programs throughout our community programs. And next week we will be getting another shipment of the BioNext Now. So they're only good if they're in hands. And so we're working really hard to have them in homes, so when they have a sickness, an illness, they're there ready for them to use. Okay, now I'll turn it over to Dr. Battle.
So a recap of the recommendation I gave to you at the last regular board meeting is the recommendation to revise our visitors and volunteers, health and safety protocols. So we want to welcome individual and groups back during the instructional day. The current health and safety resolution that the board adopted only has visitors after the instructional day. So this is a change from that. And as I said earlier, a draft resolution will be discussed by board members. It is still up to the discretion of the principal direction, and it's dependent on the building logistics. Next recommendation I'm making for face coverings or masks. For staff, I'm changing from required to recommended when working with students aged 5 and over. A mask required when working with any pre-kindergarten program. And for students, mask recommended for ages 5 and over, and mask required if over 2 years of age and enrolled in any pre-kindergarten program. Effective date, Monday, March 7th. The next slides are links for the public for the first resolution, which I'm asking the board to rescind the current health and safety measures they adopted on August 12, 2021. The next resolution is related to visitors and volunteers. And then the last resolution is related to face coverings. So each one of the second and third resolutions codify the recommendations you saw on the previous slides. And with that, I think that concludes our report. It's a thank you, is the last slide.
Thank you.
Yes.
Do any board members have comment or question before we move to new business? Director Werb.
I'd like to make a statement. It has been 2 years since we have been declared under a pandemic, and COVID-19 has taken the lives of more than 5 million people globally. It has forever changed our lives, and I can confidently say things will never be the same as they were before COVID-19. As a society, we have come to rely on lessons from the past, as well as those who are experts in epidemiology, virology, infectious disease, and immunology to guide us as we have navigated the unpredictability of the COVID-19 pandemic and the uncertainty it has brought. It is with certainty I can say that there's one thing we have done since the onset of the virus and the pandemic that has protected us from unbridled spreading of the virus and a much higher death rate. It is wearing masks. Wearing masks allowed us to come out of lockdown in the beginning stages of the pandemic. Wearing masks has allowed us to return to work, although for some of us in a somewhat hybrid form, still back in the office setting. Wearing masks allowed our students to return to in-person learning. To say it bluntly, without masks, there would still be uncertainty and chaos. When it comes to making the decision to recommend removing masks after 2 years, it is no easy decision. We have become comfortable wearing them. In some sense, they have become a part of us and our daily lives. We must respect that for some people, taking off the mask is simply not that simple. It may be frightening. However, they have served their purpose and kept the virus in check to get us to the point we are at. But we must find a way to start preparing for more of an endemic than a pandemic and make decisions that provide solutions to ways we can coexist with the virus while still trying to live a normal life. We must come to terms with the fact that we cannot keep the masks on forever. As we have from the beginning of the pandemic, we've followed the instructions from medical professionals and experts in disease control. If they are telling us when and how it is safe to take off the masks, we must listen. The decision to revise our mask policy is not one we take lightly as a board. I personally have put a lot of thought into my decision on this matter. We have come a long way and taken great strides in this district to keep our staff and students safe. I am very proud of the decisions that we have made as a board and as a district to require masks up to this point. I believe it has been pivotal in us being able to keep our students safe while learning in person. Above all else, it is the students and staff that serve them that are the most important in our district, and keeping them safe is our top priority as board members. In reviewing the current data from the county and the guidelines from the CDC, we are now considered at a low transmission rate. Taking this into consideration, I believe that we should move to guidance that recommends, not requires masks indoors for K through 12, but requires masks for all visitors. While I feel this is the right decision for our older students, I hear the voices of our community and echo their concerns over our youngest learners who are not yet able to get vaccinated. They do not have the option to have the protection against the virus, and as such, I believe masks should still be required for our youngest learners who are in pre-K and volunteer pre-K, and those staff who interact with those pre-K students and children. We should continue to follow the guidance as set forth by the CDC, which allows for counties to follow masking guidelines determined by cases, transmissions, and hospitalizations. We should continue to be diligent and make decisions that warrant changes if rising levels deem it necessary. Thank you.
Thank you, Director Webb. Other comments, questions? Director Alt?
Just a comment, excuse me, just a comment to echo Director Werb's, part of Director Werb's statement. I certainly would not imagine I could be as eloquent as she in making the points on our behalf. We have all put a lot of thought into this, and a lot of time and effort has gone into, making sure that we do our best to keep our staff and students safe. And I know in the last, weeks, we have heard from staff, we've heard from families on both sides of the fence, and it's not easy. I'm concerned for our youngest learners. I also have heard from, our older students that, pretty much everyone recognizes that they would love to be done with masks. And in the same breath, they mention, if the mask were to go away, I probably would still wear it when I'm in school. And it's up to the individual, obviously. The choice is there. I do, having had conversations also about, bullying and the social emotional health of our students, I think, depending on the action of the board tonight, I would hope that in our schools, there is increased attention to how that shift might play itself out for our students. And, whereas staff might have previously been fighting to have students keep the masks on, now there might be other implications with the mask coming off, who's taking theirs off, why, that really doesn't matter. It's up to the individual. Whatever the choice of that individual is, we need to respect that person. But yeah, I come to this with an open mind and appreciate the thoughts and comments of my fellow board members.
Any other comments? I just want to thank you, Director Webb, for your words. You did speak them very eloquently and to reflect a lot of the thought that this board has been going through in terms of coming to this decision, this conversation tonight. I also want to thank you to Bernie Bean and Dr. Battle too. I really value and appreciate what you said about going into the pandemic and people becoming slowly comfortable or quickly comfortable wearing masks, and that the same approach and same consideration and respect need to be happening in this as we approach this endemic as well. And that should be heard amongst staff, community, and our students. There are going to be students, like Director Alt said, who are going to still wear masks, and that's their choice. There are going to be students that take them off, and we have to respect the choice of the individual. So I really appreciate that coming in. So we will now move to new business. The The first is to adopt the 191 resolution rescission of health and safety measures authorized by school board action on October 12th, 2021. Dr. Battle.
Thank you, Chair Chester and members of the board. I want to make sure I am reading the first one correctly. I am recommending that the Board of Education adopts the District 191 resolution rescission of health and safety measures authorized by school board action on August 12, 2021. Whereas Minnesota Statute 123B.09 vests the care, management, and control of independent districts in the school board. And whereas, by action of the school board on August 12, 2021, it adopted health and safety measures for the 2021-2022 school year regarding mask requirements, and whereas the Centers for Disease Control and Prevention, CDC, issued new guidelines on February 25, 2022, whereby 1, masks are no longer required on school buses, and 2, guidelines for masks are based on COVID-19 community levels of low, medium, or high, and whereas the community level of COVID-19 cases in Dakota County, Minnesota, and Scott County, Minnesota is low. Now therefore, be it resolved by the School Board of Independent School District Number 191, effective March 7, 2022, to rescind the mask requirements and all other action pursuant to the board resolution on August 12, 2021.
Do I have a motion to approve this recommendation?
So moved.
Moved by Director Alt,
Second.
second by Director Miller. Any discussion? Seeing none, all those in favor, sorry, Director Connor.
So to rescind it, that means without any exclusion, any,
We're taking it away so that we can bring forward new resolution.
okay.
Okay. All those in favor say aye.
Aye.
Opposed? The motion carries unanimously. Next on our agenda is adopt the resolution of the School Board of Independent School District 191 regarding health and safety measures for visitors and volunteers. Director Battle.
Thank you, Chair Chester, directors of the board. My recommendation is that the Board of Education adopts the resolution of the School Board of Independent School District Number 191 regarding health and safety measures for visitors and volunteers. Whereas visitors and volunteers to our school district strengthens partnerships, supports the learning environment for all students, and welcomes individuals and groups to the school district. And whereas Policy 903, visitors to school district buildings and sites, has the purpose of informing the school community and the general public on procedures and requirement of visitors to school buildings and other school property. And whereas the Centers for Disease Control and Prevention, CDC, issued new guidance on February 25, 2022 on public health issues related to COVID-19. Now therefore, be it resolved by the School Board of Independent School District 191, effective March 7, 2022 as follows. 1, the superintendent is hereby directed to implement Policy 903 regarding visitors and volunteers without any school district requirement for masks or other face coverings. 2, the superintendent is hereby authorized, after consultation with the school board chair and notification to the school board, to implement different mask/face covering requirements for visitors and volunteers within the school district or a specific school building without school board action if the superintendent reasonably believes that immediate implementation is necessary, and that constraints of time and public health considerations render it impractical to hold a school board meeting prior to the change. Any change in mask/face covering requirements shall continue until the next school board meeting at which the change is addressed.
Do I have a motion to approve this recommendation?
So moved.
Moved by Director Hume. Second by Director Connor. Is there any discussion? Seeing none, I think well, I have one thing. Because in the next resolution we are adopting, or being recommended to adopt, would be where it's broken down of requirements for those that are with PK children in our school buildings, and those that, where it's required, and those that are there that are older than 5 and is not required, it's recommended. The language in here doesn't necessarily imply that differential for the visitors, and so just, is there a way that's being covered in some way in this resolution?
Thank you for the question, Director. Chair Chester. So in this particular one, it would only make a distinction in 2, but it's not explicit that we would require visitors and volunteers to wear a mask if they were invited into the preschool program. Is that what you're asking?
Yes.
So no, it's not explicit for that. Bernie, did you have anything to add?
I don't have that right in front of me, but visitors and volunteers going into a preschool learning environment, if our staff is wearing a mask, it seems reasonable that a visitor would be wearing a mask also in that setting.
And it's recommended, but it's not required, like the verbiage would be in the next resolution. So would it be up to a teacher in that room to ask the visitor to mask then, if it's not required?
So we do have the principal's discretion.
Okay.
So I wouldn't ask a teacher, but a principal to say at discretion if you're going into preschool to wear a mask.
Yeah, we don't want the teacher to have to be the person to enforce or not enforce.
Right.
They need to teach.
Yes. Director Alt.
Just to discuss this a little bit.
Yeah.
You make a fair point,
Yes.
and I personally wouldn't even want to necessarily put it on the principal. I would rather have it codified in the resolution that regardless of who you are and what your role might be in the classroom, anytime you're near, pre-K, under 5-year-olds, you must be wearing a mask. So,
Director Miller.
I apologize, I don't have the in front of me either. But my understanding is this references the following, the third resolution, as far as the terms of the mask wearing, correct? This, what we're doing now, this is simply a transference of media C power to
Yes.
the superintendent. So we really
Number
should probably be
2.
having this discussion under the third resolution, correct?
And then revise that.
Under the third resolution.
but the third resolution is specific to employees and students. It doesn't mention
It does not
volunteers
This one
or
is specific
visitors.
to visitors in the buildings.
So it's either happening here in the volunteer in
Right.
903, or it's
Or
happening
we're
in the
editing
third
the
one.
next one.
Exactly.
And what does the language currently say in reference to volunteers and visitors?
It currently says that there's no mask requirement.
It would revert to policy 903 without
Yeah, okay.
requirement for mask or other face coverings.
I think that we should move this to the third resolution because
Okay.
we shouldn't be sticking something in this resolution that would require coming back and undoing or unpacking this resolution later if we decide to make a change. This resolution should stick to its core reason of existence, and that was the transference of power to Dr. Battle for short-term needs and making decisions.
Fair enough.
That would be my take. So
Okay.
what we will need to do is have a motion to strike this from this this part, we would strike the language, pass that resolution, pass that motion, then we will vote on the larger, back to voting on this as an amended resolution. And then when we bring up the third one, then we can have a motion to add additional language to that in the same procedural process.
But this is focused on volunteers, the other is focused on masks,
Yeah.
is what you're saying.
For
Yes.
Volunteers and visitors.
Right, right, masks for
everybody.
Right, right.
people as they're related to, yeah.
Yep,
The
yep.
So we're,
Okay.
yeah, okay.
I'm
I'm
in
not having it in
agreement,
front of me,
I'm
does somebody else want to make the motion?
So we have a motion
What's the
and
mo-
a,
I'm confused
You have to
what
state the
is
motion,
for this.
so-
The one we're talking about is just the visitor one.
Right.
So what is the motion? I'm not,
we have a motion and a second to approve
approve.
this one.
Yes.
So are we?
Whole resolution, this is the second one, and this is for the transfers of power to Dr.
Yeah.
correct? Do we want the
For
language?
visitors and volunteers specifically.
I think the resolution is in general to everything,
No,
isn't it?
it's exclusive to visitors and volunteers.
It's exclusive, okay. Then I have a general problem with this, because you realize that what this means is if she needs to shut down a building or something, we have to come here and have a meeting that night.
Because of.
That's the reason we had the original resolution in place, the one we rescinded. It's to give Dr. Battle the flexibility to move quickly if need be without having our vote.
Right. Well, and this would still give.
Yeah,
And it would still give that in this resolution specific to volunteers and visitors.
And it would basically, as I'm reading it, we would simply strike the verbiage in number 1.
Yeah.
The
that's what-
superintendent is hereby directed to
Okay,
implement.
that's what I said.
May I
think
ask
we went around a couple
Aaron to
times.
pull up the resolutions? We can actually see it if you want.
Well, it's available,
Okay.
it's up to Chair Chester.
Yeah, that's fine.
So click on the two. Okay.
I just want to
There we
make,
go.
I'm trying to make sure I'm following. So, because number 2 is the authorized use.
Yep.
But then we're saying something about 1.
We would strike it all together, right? Is that?
Or have it end with, it would be the superintendent is hereby directed to implement policy 903 regarding visitors and volunteers.
Period.
Period.
I like
We
that.
would move to remove without any school district requirement for masks or other face coverings.
because then we would build that.
Because then
into
we would
an amendment.
amend the next one.
Right.
Okay, yeah, that makes sense.
However, yes.
Yep.
So
Okay.
I'll make a motion to amend so that the item number 1 in this resolution reads, "The superintendent is hereby directed to implement policy 903 regarding visitors and volunteers, period." We would strike the language without any school district requirement for masks or other face coverings.
Do I have a motion to approve the
She
amendment?
made the motion.
Oh,
I
she made
second the
the- okay.
motion as
Direct- okay, so we
to
have the-
amend the resolution on the table.
Okay, so
Yes.
we have a motion by
motion,
Director Alt, a
second.
second on the amendment with Director Miller. Any questions or comment?
I just want to be clear that I'm clear. So we're removing everything after the word regarding visitors. Hereby directed to implement policy 903 regarding visitors and volunteers, period.
Yeah,
And we're taking out the rest of that sentence and all of point 2?
no.
Oh, no.
Point
Point
2
2 stays.
Two stays.
Yep, giving, yes,
Just talking about number 1.
yep,
That's what I wanted to clarify. Thank you.
okay,
So now we take a vote on the amendment.
Yes.
To the resolution.
yep. Any other questions or comments? Okay. Seeing none, all those in favor with the amended language
No, wait, no, you're just voting on the amendment.
on the amendment?
Yep.
Okay, on the amended,
On the
And we
amendment.
vote on it.
And then we're going to have to re-vote again on the whole resolution as
Yes.
amended.
okay.
Yes.
Well, yeah, the amended language, great.
Correct.
All those in favor of the amendment.
All those in favor of the amendment, thank you. Say aye.
Aye.
Opposed? That carries. Now we go back.
Yes, now we have the, do we need
Do
to
we
take
need
a-
a re-motion?
No, I don't think
Okay,
so.
Do I need to-
as amended. We don't need another motion or second, okay. All right, so as amended, all those in favor of this resolution, say aye.
Aye.
Opposed? Great. Motion carries unanimously. Should reread my Robert's Rules of Order. This is all new. Third on our agenda is to adopt the resolution of the School Board of Independent District 191 regarding health and safety measures regarding face coverings. Dr. Teresa Battle.
Board Chair, members of the board, my recommendation is that the Board of Education adopts the resolution of the School Board of Independent School District 191 regarding health and safety measures for face coverings. Whereas Minnesota Statute 123B.09 vests the care, management, and control of independent school districts and the school board. And whereas the superintendent of schools is responsible for the administration of all school district policies and is directly accountable to the school board. And whereas when responsibilities are not specifically prescribed, nor school district policy applicable, the superintendent is expected to use professional judgment, subject to review by the school board pursuant to School District Policy 302, Superintendent. And whereas the Centers for Disease Control and Prevention, CDC, issued new guidance regarding prevention steps based on COVID-19 community levels of low, medium, or high, and whereas the COVID-19 community level in Dakota County, Minnesota, and Scott County, Minnesota, is classified as low, and whereas the superintendent and the administration of the school district have conferred with the school board regarding the prevention steps set forth in the CDC guidance. Now therefore be it resolved by the School Board of Independent School District Number 191, effective March 7th, 2022, as follows. Masks are recommended for employees when they are working with students age 5 and older in school district buildings. 2, masks are recommended for students age 5 or older while in school district buildings. 3, employees are required to wear masks when working in any pre-kindergarten program in the school district, subject to the disability exemptions and reasonable accommodation requirements under state and federal law and or public health agencies. 4, masks are required for children older than 2 years of age when participating in any pre-kindergarten programs in school district buildings, subject to the disability exemptions and reasonable accommodation requirements under state and federal law and or public health agencies. 5, the superintendent is hereby authorized, after consultation with the school board chair and notification of the school board, to implement different mask requirements within the school district or any specific school building without school board action if the superintendent reasonably believes that immediate implementation is necessary and that constraints of time and public health considerations render it impractical to hold a school board meeting prior to the change. Any change in mask requirements shall continue in effect until the next school board meeting at which the change is addressed.
Do I have a motion to approve this resolution?
So moved.
Moved by Director Miller,
Second.
second by Director Werb. Is there discussion or amendment recommendations?
Well, so I think we need to consider who is with the students ages who are in the pre-kindergarten program, and I think that's employees, it's volunteers. I believe sometimes there are older students as well who are in those classrooms, but I don't know if they would be considered volunteers or.
I think we want to limit, we don't want to limit ourselves by saying volunteers or something, you know, that gets, let's just say employees or anyone else working with, you know, something to that effect.
Sure.
Or any persons, employees or any persons, or any other persons.
Yeah, we also want to address the fact that our pre-K kindergartners are also riding buses with our older children as well. And so do we require the bus driver who we have a contract with to wear a mask, or how do we mitigate the buses? And so I think, yeah, however we choose to change or amend to adopt language to include either all persons or contractors, volunteers, and visitors, you know, how do we want to phrase that amended language? We need to have that in consideration.
Would be all persons, including bus drivers and,
Contracted.
could be contractors, yeah.
Okay, but I am at a loss. I thought we were, I thought we had essentially rescinded the bus situation altogether. So this was the intention of this resolution to encompass buses?
So Director Miller, members of the board, the stipulation for mask requirement on transportation was rescinded by the CDC. I do believe it's well within the authority of this board to require on buses.
Well, I have no doubt of that. What I'm asking was that what was the intention of this resolution? Were we looking to cover buses with this resolution, or was this simply our buildings and our programmings?
So considering your conversation, there are other persons than employees that interact with our preschoolers. One
I understand
One
that,
group
but-
are the bus drivers, so they
Yeah.
are on the on the buses.
Yep.
Yes.
Do we have circumstances where we have preschoolers and older children mixed together on buses?
Yes.
Yes.
So as soon as a preschooler steps on the bus, we're saying the bus driver must put on a mask at that point?
Well, and is it, just following that train of thought, is it just the bus driver?
Yeah.
I mean, if there are older students, and I'm guessing they would be other elementary students only.
Yeah. I do know that some of our other member districts had voted whether or not they would require masks on buses or not. And there's some that are only recommending and then others that are requiring. So that was up to each district and their boards. But I believe that might have been a separate vote or another bullet on their voting.
Gotcha. Is there a recommendation from staff?
So are we going to amend this because of this discussion then?
Yes, we're looking to maybe amend the language.
Okay.
Trying to figure it out.
I'd be curious
So
to hear the answer to that.
considering-
That's a good question.
So Director Alt and members of the board, considering the discussion held tonight, one option is employees, volunteers, visitors, and contractors. Or as Director Miller stated, employees and any other persons interacting with the pre-kindergarten, and that would cover the students.
Right,
But
but
then you have to call out the buses for the elementary to wear their mask, if you're, as
I
you
guess the-
stated, Director Alt.
Right, and I guess the question is, this is coming out as a result of board discussion. I'm wondering what discussions were had around students on buses among staff and with the committee.
So we also talked about having the preschoolers sit in the first few rows to have a separation from the other elementary students where we could. We did discuss the bus drivers wearing a mask because preschoolers are on the bus. We also discussed the option that it's well within my authority that I could actually, if you gave me the authority, I could make it. It doesn't have to be in the resolution.
I'll draw your attention to the fact that point 3 is the only place where we've left open this conversation. The rest of the 1, 2, and 4 all specifically call out school district buildings. So I would, at this point, suggest that we stick to this resolution being about the buildings.
Okay.
We can either leave the bus situation to the individual discretion of Dr. Battle, and in consultation with our partner, our transportation partner, because I do think there's a fair amount of things that get unpacked when we start talking about that can become tricky. So each individual bus might actually be in a different example or situation where what's appropriate. Or we come back later with yet another resolution that directly deals with busing circumstances.
I don't feel like I have enough information to really make a
Exactly.
decision about
Right.
buses
So
tonight.
I think we should stick to buildings is mine.
Yeah.
Okay.
And then Dr. Battle, you and your team can discuss it and decide if there's another recommendation to bring forward.
So what does that mean for buses on Monday?
So if you go with number 5, you would give me the authority.
Okay.
If you pass this resolution as is, that's one of the options. I could make the change, granted, as the superintendent, and you could take it up next Thursday. But then, as you said, what happens Monday on the buses? So then the board would have enough time to come back on Thursday and review my decision on that particular piece.
Yeah, I think with more information, you make the decision that's necessary for Monday.
Yep.
But then, I think we do need to, I personally believe that just to make sure we're doing what we can for our students' wellness and clarity, that if there is going to be any requirement for masks on a bus, you can certainly figure that wording out and bring it forward.
And I believe the COVID advisory group meets tomorrow too, so there'll be that opportunity to have that discussion then as well.
I have a question. So do 3-year-olds, because you mentioned 2 and up, and 3-year-olds are still considered pre-K, do 3-year-olds wear masks? Well, if they're wearing masks, aren't they protecting themselves?
Well, this doesn't require that, though, because it only requires them to wear it in buildings.
In the building.
This resolution would
Okay,
not
well, we'll just
encompass
leave the whole
buses in
bus
any
thing.
manner.
Yes.
All right.
All right, so I'm going to make,
The both.
I'm going to make a motion then. I move to amend the resolution in front of us, item number 3, strike the first part of the sentence up to the comma, and rewrite that section to state that any person working in any pre-kindergarten program in a school district, a school district building are required to wear masks, comma, subject to
all that stuff. Okay. Would you,
Okay, can you say that again?
I will.
Jamie, did you get that?
Okay, so we strike everything before the comma,
everything to the word subject.
up to the word subject, yes. And then it read, any person working in any pre-kindergarten program in a school district building are required to wear masks.
He's got it highlighted up there too, Jamie.
I think technically you'd have a second comma in there, but that's all right. Grammatically speaking.
Yep, so we want to, do I have a,
That's my motion for that.
okay, do I have a second?
Second.
Second by Director Connor. Any discussion on the amended language? Seeing none, all those in favor of the amended language, say aye.
Aye.
Opposed? The amended language carries unanimously. Now back to the original, the resolution as amended. Any other discussion before the vote?
I do, actually.
Yes, Director Miller.
So I just also want to echo some of the comments made earlier. Thank Beanie and Bernie and Dr. Battle for your work on this, getting this stuff together this week. I think that it's profoundly unfortunate that leaders in our national discussion and global discussion have turned masks into something more than what they were intended to be, and that was a protection of our ability to gather and function somewhat as a society. So I also believe strongly that if you were reading science, paying attention, even reading some fiction out there over the years, we're at a spot in society's development that was probably pretty obvious is going to happen, that we're getting to a point where we're going to have to protect ourselves. Masks, I just want to be very clear. We're not voting to throw away masks tonight. We're not voting to get rid of masks. Masks are now part of our lives. I've traveled all over the world, and masks are part of their lives in other parts of the world. We just are a little slow to get to the game. Masks will be here. They're here to stay. We might very likely all be putting them on again very soon. We might occasionally wear them when we're not feeling well, which hopefully we are doing. We might find other people around us wearing them for their own comfort, their own security, or maybe just simply because they care about their neighbor and don't want to get them sick. That's fine. And I want to stress that we should be making sure throughout our administration, all the way down to all our buildings, that wearing a mask in the classroom, in the building, comes with no additional baggage, No additional commentary. You're doing what you want to do for yourself, whether you're a 5-year-old or an 18-year-old, or a teacher, or an administrator, or a visitor to the building, it doesn't matter. Masks are here, they're part of our lives, let's just get used to it. All we're doing tonight is just saying that we've reached a point in this endemic control that we no longer feel that we need to have masks required everywhere to protect everybody. That's all we're doing here tonight. Thanks.
Director Alt.
I completely concur. I would also add whether you wear a mask or not. Your choice.
Yes,
There's no baggage whether you're wearing a mask or
or
not.
not, yes. Any other comment? I also just want to reiterate too that even though we're talking about masking, none of our, just for the community here, none of the other mitigation strategies that we're doing is going away. We are still cleaning our buildings, we're still asking for people to sanitize, we're still ventilating our buses, we're still doing all of those procedures to keep ensuring the safety. It's just that we have we're no longer deciding for people whether to keep the mask on or not. And I am immune compromised, and so you will still see me wearing a mask. That is my choice, depending on how we choose to vote, but just wanted to demonstrate that out there here too, that each, even at this board table, we might see some of us in masks, some of us not as well, based off of our comfort levels and our own individual unique health issues. So
I'll just say that as a leader, if I choose not to wear it and you ask me to put it on, I'm putting it on immediately, out of respect for you. That's what this should be about. Respect for our fellow
Yes.
citizens and family around us.
Madam Chair?
Yes.
And I would just like to add, some of the verbiage says face covering, some say mask. I think at this point, a face shield should be considered. It's not a mask, but it's still a face covering, and it still protects things from your mouth, from spreading. So that's just my kind of twist on it.
Mm-hmm. Oh, so are you asking to amend
Oh, boy.
from mask to face covering?
Well, my comfort zone is, I think, they should have something on their face. And I know even with the preschoolers, some teachers would feel more comfortable if their mouth and face were showing to the kids. And I know some have adopted the kind where they do have their mouth showing, but just as a rule, I think face coverings would be okay for volunteers or some, just as long as
But
they're.
I think the recommendations are that the N95s are the ones that prevent the spread.
Oh, the KN95,
Yes,
yeah.
those,
When we're
that's,
in a
what-
pandemic,
but they're still saying that that's what is recommended as far as the least amount of transmission from you can attest to that, Bernie?
Correct. Of course, the N95 is the best, then the KN95. A cloth mask is about 50 to 60% coverage with the Omicron. But something is better than nothing.
Yeah.
Yeah.
And even if a individual chooses to wear a face shield instead of a face mask, that's better than nothing. And that's their choice and their comfort on their journey.
well, that was just my put in on it.
Okay. All those in favor of the amended resolution, say aye.
Aye.
Opposed? The resolution carries unanimously. That adjourns our meeting tonight. Thank you, everybody.